Betty. My name is Hallie, and I'm one of the student nurses that'll be working with you today. How are you doing?
I'm doing well, thanks.
Good. So it looks like the doctor ordered a blood transfusion process for today. So did the doctor come in here and talk to you about everything?
Yep.
Do you have any questions? I'll bring the doctor back in here if you do have any questions regarding the procedure.
I do not have any questions.
Okay, good. Well, then we'll get started. I have the bed at a nice working height here, and I'll just provide for privacy. So just a couple things first. Can you just confirm your first, last name, and date of birth for me, please?
Betty Jones, 05/21/1952.
Perfect, and thank you, Betty. And do you have any allergies to anything?
I do not.
Okay, no allergies. Good. All right, Betty. So I am just going to do a quick assessment on you before we get started here. So we just want to make sure that vital signs are stable and that lung sounds are clear, okay?
Okay.
All right, so we got you all hooked up to vitals, and it looks like your vital signs are stable and your lung sound clear. So before we get any further, Betty, now that the doctor has explained everything and you feel like you have a good understanding of the procedure, I do just need you to sign this consent form. So on here it says that you, Betty Jones, have authorized Dr. Avery to provide 1 unit of packed red blood cells today, and he has signed it. So I just need your signature, and then this consent form will be complete.
Okay.
Perfect. So then before we get started, it looks like you do have an IV established already. It looks like there is a 20 gauge needle in there, which is perfect. We need between 18 and 22 for blood transfusions. So I'm just going to make sure that your line, check the patency of the line. Just make sure there's no occlusions or clogs or anything in here that would hinder the blood transfusion process, okay? So this is just some normal saline that I'm going to grab and put in here, and just make sure that everything looks clear and good to go. Great, that looks good. I don't see any occlusions or any concerns. All right, so now that we have the consent form signed and we're getting closer to getting things started here, I'm going to have another nurse come in, and he's just going to confirm the blood and bring in the blood. There is just one armband that I have to put on. I know you have your hospital wristband already, but this one is specific to the blood transfusion process, okay?
Okay.
So I'm going to put this on, and then it looks like Nurse Sam is just about to walk in with your blood here. Okay, Nurse Sam, so are you ready to go over the blood with me?
Yep.
Perfect. All right, so we have med rec number 224466.
Med record number 224466.
Location is HLRL.
Location HLRL.
And the account number is 123456.
Count number 123456.
We have Betty Jones here, date of birth 5/21 of 1952.
We have Betty Jones here, birth date of 5/21 of 1952.
And then the red armband number is 4566654.
The red armband number is 456654.
Thank you. And then patient blood type is B positive.
Patient blood type B positive.
Donor pool number is 7890.
Donor pool number 7890.
And there's 4 units in the pool.
4 units in the pool.
The volume is 250 milliliters.
Volume 250 milliliters.
And the blood component is PRBC, or packed red blood cells.
Blood component PRBC.
Thank you. Expiration date and time is 11/21 of 2022 at 1500.
Expiration date and time 11/21/2022, 1500.
And the donor blood type is O positive.
Donor blood type O
The
positive.
compatibility test says completed.
Compatibility test completed.
And on 8/26 of 2022.
And that was dated 8/26/2022.
Thank you. All right, he has the blood all ready for us. Thank you so much, Sam. All right, Betty, so again, if you feel like you have any shortness of breath, headache, chest pain, side pain, back pain, or abdominal pain, please bring it to my attention right away, and we'll immediately stop the transfusion process, and we'll bring the doctor in here, okay? So along with the blood, we are going to run some normal saline today with the blood. This is important to run with the blood, and it is important that it's just normal saline, not lactated ringers or dextrose solution. So it does indeed look like this is normal saline, and the expiration date is July 17th of 2023, and it is not expired, which is perfect. And I'm just going to give this a few turns just to make sure there's no floating objects in here and no air bubbles, okay? So that looks like that's good to go. And then same with the blood, I did check the facility protocol, and it does not look like we need to have it warmed or any special transfusion processes. And I'm also just going to give this a couple turns just to make sure there's no floating objects, no air bubbles, anything like that. And these both look great. So before we get started, I'm just going to put some clean gloves on and wash my hands, and then we'll get this all started, okay? So yeah, yeah, like I said, just please feel free to call it to my attention and stop me if you feel any shortness of breath, anything like that, okay?
Okay.
Are you comfortable?
Yes, I am.
Okay, good. All right, so we're gonna start getting things hooked up here. So first, I am just gonna hang the normal saline solution. And then I'm just gonna prime the line first before I do anything else. All right, good. All right, the line has been primed with normal saline, so I am just gonna close this off. Make sure this one is closed off too. All right, and then we'll get the blood. Again, just toss it around, make sure there's nothing, no floating objects, no air bubbles, and it is not expired. The expiration date is 11/21 of 2022. Alright, there we go, and I'm just gonna lock this, and before we do anything, before we prime the line with anything, I'm just gonna make sure these are untangled, and then I'm also gonna fill up the drip chamber here and just make sure that's good to go. So we'll fill the drip chamber up with normal saline first. And then just let that prime through. Make sure we get all the air bubbles out of here. Alright, good. So the normal saline looks good. So again, I'll just make sure that the normal saline is locked. And then I'll open up the blood here and we'll just prime this through. So I'm just gonna give it a good couple squeezes. And we'll prime that all the way down to the bottom of the line. Alright, good. Perfect. So now that is all primed, and I'll make sure that this is unlocked, and then we'll get it set up to the IV here. Alright, so you are not a new patient here with us today. We are on the adult ICU. Channel A will select. These are guardrail fluids, and the component is red blood cells. Yes, this is correct. And the order is to be infused at 50 milliliters per hour, and there's 250 milliliters in the packed red blood cells, and I don't want it to run completely out on you, so I'm going to set it to 225 milliliters. So that's all set up, and then I am going to just clean your IV site off here. And then we will start getting you hooked up. And the IV site looks good. There's no masses, swelling, bruises. Does it feel tender at all?
It does not.
Okay, good. So then we'll put this in, and I'll unlock the roller clamp, and then we'll start the infusion, okay? Are you comfortable, Betty?
I am very comfortable. Thank you.
Okay, good. All right, so we're going to make sure this is unlocked, and then I'll hit start here. All right, perfect. So I am going to stay with you for 15 minutes, okay, Betty? And just make sure that everything is going smoothly. And then I will also be assessing vital signs every 15 to 30 minutes. Once the blood fully transfuses, then we'll want the normal saline to transfuse, okay? So then I would document here the date and time, how much blood we gave, the amount of blood that we gave, the type of blood that we gave, the date and time, and also the IV assessment as well too, okay? So like I said, I'm going to stay with you for 15 minutes and we'll reassess those vital signs every 15 to 30 minutes. Across the lifespan considerations would be the gauge needle for a pediatric or geriatric patient, also double checking to make sure the facility protocol doesn't recall or call for any warmed blood or any kind of special transfusion. And I think that concludes the skill of blood administration.